What if I told you the perfect business model isn't built on innovation, but on dependency? It's called chronic disease, and you as the lifelong patient and eternal debtor. The multi-trillion-dollar healthcare model isn't built on curing you. It's built on owning you. Chronic disease is the perfect contract, guaranteeing a lifetime of profit until death. I'm going to unpack the healthcare system that profits from lifelong treatment over any genuine cure. Finally, I will explain why longevity medicine is your only option to cut yourself out of this engineered matrix. Welcome, my name is Dr. Edward Amran. I've been practicing clinical medicine for 31 years. Thank you for joining me. The chronic disease paradigm of modern medicine is flawed and broken. All the chronic diseases of aging are progressive and destructive with no permanent cure. There is no cure for hypertension, diabetes type 2, coronary artery disease, just to name a few. When you're diagnosed with a chronic disease, the damage is already done to your DNA, and modern medicine can't fix that. This is an age-dependent, irreversible event. The problem is coupled to our economic system. Capitalism demands payment and a debtor-creditor relationship forever until you die. Think of chronic disease as the perfect business model, a condition you live with for decades, requiring a lifetime of prescriptions, treatments, and follow-up. The acceleration of disease progression is reduced by treatment, but all the chronic diseases are progressive, resulting in functional decline, disability, and ultimately death. We have to look at the design of the medical system regarding a classic age-related chronic disease, hypertension or high blood pressure. Hypertension development starts during young adulthood. It's insidious and silent, often presenting with no symptoms unless you measure for it. Nearly 1/2 of all Americans have the diagnosis by the current definition. Why is this important? Because hypertension is correlated with stroke, heart attack, congestive heart failure, kidney failure, and even dementia, all severe chronic diseases of age. Hypertension represents a continuum of progressive vascular damage over time. It initially starts during young adulthood, and the damage ravages your blood vessels decades before the current medical definition of systolic blood pressure greater than 130 millimeters of mercury can be demonstrated. This brings to mind an interesting anecdote I recall from my childhood. In the early 1970s, J.I. Rodale was an early advocate of organic food, low-fat and sugar diet, daily exercise, and by reports took 70 supplements daily. He died at the age of 72 on an episode of The Dick Cavett Show in 1971 from a massive heart attack. He obviously neglected to pay any attention to hypertension or his cardiovascular risk profile. Lifestyle and or diet interventions are important, but are unlikely as standalone interventions to extend your natural lifespan. I've been doing clinical medicine for 31 years and personal anti-aging treatments for 10 years continuously. I've come to realize some deeper truths regarding these treatments. Number 1, these treatments really work. Number 2, the treatments require 6 to 12 months of continuous therapy before any realizable benefit can be demonstrated, and should be personalized on the individual's unique physiology. Number 3, age reversal in humans is not possible in 2025. However, aging arrest is achievable at treatment onset. We can keep you at a particular biological age for an extended period of time. That's what we're offering at Blue Lotus Longevity Clinic. I started my treatments at age 50. In hindsight, I wish I started when I was 30. Initiate treatments as soon as possible to achieve the greatest benefits. Thank you.